Excuse me. Oh, again, here comes our dog Poochie over here. So, so we're talking about dissociative identity disorder, the grandparent of all dissociative disorders, multiple personality disorder, DID. And what we really want to talk about, and we might have mentioned it, is that there are certain folks who are true believers in multiple personality disorder and think it happens at a very high prevalence rate, upwards of 6 or 7% of an inpatient population, and an inpatient chemical dependency population. There's studies I'm holding in my hand that you'll be able to read. A person identify something like 15% have multiple personality disorder. And then there are other folks, mental health professionals, who are very, very skeptical about those numbers. In fact, there are many, many mental health professionals who believe that if DID exists, it's extremely rare. And there are many mental health professionals, possibly even a majority, who don't believe it exists at all. So what we want to do is we want to have a debate taking both sides of the issue of, does multiple personality disorder exist and is underdiagnosed, or does multiple personality disorder simply not exist and it's sort of a romantic fiction that Hollywood likes, you know? And it's a real important debate because it's one that's been going on for 30 years or so. So just before
you're going to be able to weigh in on that as
you certainly are. Well, maybe we'll have an online voting system or something. But before we get into that debate, what we want to do is just say that a person, Dr. Ross, is a true believer in DID, and he's done us a real good service because he invented something called a dissociative experiences scale. I'm holding it up right here. It's also been uploaded onto Sakai. The reason both of us really like this is because it lists 28 different dissociative experiences and has a person rate whether they've ever experienced it and what percentage of their lifetime. And what's cool about it is that many, many of these, perhaps half, almost all of us can admit to having experienced. So we all agree that dissociative experiences are very common. So maybe you could give an example, Louise, of the kind of a common
for instance,
experiences.
and you'll see on here, I mean, people will have an experience of reading a chapter in the book and know that they were reading, all of a sudden find themselves on the next page and not having a recollection of where they were or what they read. Now, if you were to look at them, you would see their eyes are tracking. They are actually reading the book, but from their perspective, they're gone. Like, where did that time go?
That's a good example, yeah.
Or coming down, you're driving down a highway and you see an exit and realize, wow, I just missed a whole town. And where was I? Now, you're driving, obviously. You are still there, but you've completely dissociated and can't have no recollection for the time that you were in the car. Right. Now, that's a common experience.
It is a common experience. In fact, that's one of the questions on here when you're driving and you miss your exit. And let's see if I could find that. Well, I believe that's about 50%. Driving a car and realizing one doesn't remember part of the trip, 47.8% of all people surveyed recognize that has happened to them. Only 7.5% say that happens to them more than 30% of the time that they're driving. But certainly 50% of us have had that experience, or perhaps more.
Right.
So
now, some of those it goes into that are experiences that not everybody has, but surprisingly high numbers of that people do have as you read them. For instance, looking into the mirror and not knowing yourself in the mirror. For a fleeting time or, for a longer extended time. That's one experience that they can rate on here.
Right, so just let me give you the percentage of what percentage of time people who say they didn't recognize themselves in the mirror at least one time. And this is not on drugs, while not on drugs or alcohol. So 13.6%, according to Ross, say that they've had an experience where they looked in the mirror and they weren't able to recognize the reflection they were seeing in the mirror. Now, once you start getting to those issues, it starts getting fairly astounding for a lot of mental health professionals. But again, Ross is a true believer. When you look at these results again are on page 8, and if you go a few pages up further, you'll see his actual, what he believes are the incidence and the prevalence of multiple personality disorder. And like I said, it's somewhere between 5 and 20% depending on the population. So given that, we should maybe launch into our debate and in terms of what we think about this. Okay, so I'm gonna. I'm not going to take. I am going to take a side. Rather, I'm going to take a side that's equivalent to Ross. That therapists are missing multiple personality disorder, and you're going to take a side of in the majority, more cynical, that people are diagnosing it when it really doesn't exist.
Right. And I think that to start on that is the very point that people are calling something dissociative identity disorder or multiple personalities, and they're not going to the criteria. They're naming something that isn't actually the criteria of a disorder. So happen to have a DSM-4, mini DSM-4 with me, that let's look first at the actual criteria. So the criteria for dissociative identity disorder is A, the presence of 2 or more distinct identities or personality stage, each with its own relative enduring pattern of perceiving, relating to, and thinking about the environment and self. So the presence of 2 or more distinct. B, at least 2 of these identities or personalities states recurrently take control of the person's behavior. C, inability to recall important personal information that is too extensive to be explained by ordinary forgetfulness. So ordinarily, and what I would say is some of these experiences that are considered fairly common. And D, the disturbance is not due to the presence of other physiological facts such as blackouts, substance abuse, alcohol. So it's a real disorder with real care,
at least it's a really defined
defined disorder.
So Louise, let me just ask you a question. So about how many clients or clients have you say you work with in your 30 years of practice? Just a guess.
1,500, 1,000.
Okay.
How about you? How many?
Probably about 2,000 or so.
Okay, and here's the question then. Of all those people, how many valid
meet that criteria
cases have you known that meet that criteria?
How many? Well, you answer that
I
first.
can tell you
How many?
0. Of all my time working in the mental health system, I've never actually met or known of one true verified
person who meets those criteria, who has 2 separate identities with relatively enduring personality traits.
So what do you think of, like, 1,000? So out of all those, there might be one that I would know about as a clinic manager. How about you?
Well, I'm going to take the side of the true believer. So before I take that side, I have to say that in my 2,000 clients, I have seen one person that's 35 years who perhaps met the criteria for multiple personality disorder. It was a 15-year-old girl who, inpatient, some days appeared to be a 15-year-old girl in the way she talked, walked, and dressed, and other days looked like she was an 85-year-old great-grandmother, just completely different clothes, different voice quality. But that's 1 out of 2,000 in 35 years. And so I
what
guess,
makes that not just acting for attention's sake?
Oh, well, it could have been acting for attention's sake. That's a good argument. But as I learn more about multiple personality disorder, I think that both of us and most mental health clinicians, we might not be seeing it for some real reasons. Okay. That, in other words, it might be occurring at a rate higher than what we're seeing, but it has more to do with us than it has to do with the client. So,
well, if I would be devil's advocate on this, I mean, what the first thing I see is that how prevalent it is being diagnosed now versus years ago. I mean, there's statistics that say that it was never even diagnosed before, significantly before the 80s. So all of a sudden in the 80s, in the 90s, there's a huge fluctuation of these diagnoses. Now, does that mean that there was that much more, abuse or war or huge trauma that caused these? Or, my sense is clinicians like to diagnose, they start to see it, it becomes this sexy, fancy diagnosis that's all over. So once you get those movies, The Faces of Eve, once Sybil came out, the incidents went sky high. So, that to me is fishy. If you start seeing it everywhere, and it starts looking glamorous, and people are less likely to, clinicians are likely to see that as glamorous, but the clients themselves may see that as a little bit more glamorous and more fun. And it is interesting. You start reading these personalities, it's fascinating stuff. But because it's more interesting, my sense is that clinicians then focus on the thing that they find interesting, and ignore the sort of rational reasons why that might be.
So what you're saying, that's a good argument. You're saying that clinicians aren't applying these criteria strictly.
Right.
So what are you saying if they're saying if somebody just has a slightly different mood, or they're the angry Bob, that's
right.
a different That's a different personality.
People are applying traits and personality styles to and calling it a whole disorder.
Or calling it a whole personality,
right.
A secondary, an alter.
Right, because everyone has identities, and in reality, people bring forth different identities to deal with certain traumas in their lives and stresses in their lives. So it strikes me as not surprising at all that someone who is usually quiet and withdrawn in certain circumstances might sort of bring forth a real strong identity to try to deal with something horrendous in their lives.
But the question is, and from the actual diagnostic criteria, those are two separate people with different personalities, and most likely most true believers would say those people have different names. They're not even, the person wouldn't identify like the real aggressive Bob, the real passive Bob, the real aggressive Louise,
right.
As in terms of a mood or a different set of behaviors, but a completely different name often with amnesia for the other identity.
Which is very convenient to do if your real name is Ted Bundy and you're trying to sponsor an insanity defense, which he did, and they have tapes of him showing different personalities, and went to his apartment and found books on personality disorders, or on multiple personality disorders.
So
even the name itself is interesting to me. That now that it's called dissociative identity disorder, I'm telling you, there's clinicians who are much more into it, because now it's called something that sounds much more professional than the old term multiple personality disorders. So even that can be sort of seductive to a clinician. Oh, it's like the new improved multiple personality disorder.
Okay, well I got to counter the cynic here, okay? So let me counter it, and I'm afraid we're going to have to end the segment. So my counter is that the reason you've gone your whole career, and putting my experience aside, and you've never seen a multiple personality, is because if you don't believe a person who you're meeting with has alternative personalities, they are not going to trust you enough to show you their alters. Alters serve a function. Alters aren't for no reason. One alter is to protect somebody from feelings of being vulnerable to sexual assault or something around sexuality. Another alter is a way to deal with somebody who's being critical, And the point is your role as a therapist stays pretty continuous. So what you're seeing is the person's alter, that is the alter that fits for you in therapy. And if you don't believe it, why would somebody show you another alter? And plus the circumstances don't come up. So let me tell you an example. You could be seeing a client, Jane client, and that client can be meeting with you and then excuse herself to go use the bathroom. And because when she's in the bathroom, she has to deal with her genitalia area, and that area requires another protective alter personality, can drop into this other personality while she's in the bathroom. And then when she comes back to see you and continue to meet with you, that alter's gone. She's back to the useful personality that works with the setting you're in, and knowing you don't believe. So because you haven't seen it. So I think one reason why therapists don't see it is the therapists who believe in it see it, for sure, we know that. But the majority of therapists, since they're skeptical, the alters serve a safety, protective purpose. Why would they show themselves? There's no purpose to show themselves. So that's one counter to Louise's argument. I think we need to end this tape, and we'll pick up with another segment, more arguments on does multiple personality exist at all, why perhaps it doesn't, or why perhaps it does and is being underdiagnosed. So we'll see you in just a little bit. Thanks.